Hi everyone, this is Seth Recovery. So today I want to cover what mental health is. All these videos are going to be about mental health and how to lessen the symptoms. It will cover coping skills, but for the first few videos, I want to talk about mental health, just like the definition and the warning signs and the mental health conditions. So what it basically is. Um, I'm going to go through all um, most of them, and today I'm just going to go over the basics. Um, this is actually exactly from NAMI, so excuse me for it being word for word, but I want to be accurate on what mental health is. So I don't want to just wing it and just talk about what mental health is. That will not get the definition and the exact things to look for. So this is from NAMI. NAMI is a health organization for mental health. They have had they have had regions where like there's one in Utah. There's one uh, in a lot of areas, and they have classes too for mental health, like support groups. And I went to them from about 3 4 years. Um, uh, I really recommend looking up NAMI on the internet, NAMI, and just if you think you have a mental illness and before you get diagnosed, just I would read through it and just and find out if it's worth your time to go see a psycho psychiatrist and a therapist and get treatment. So this is directly from NAMI and what mental health is. Trying to tell the difference between what expected behaviors are and what might be the signs of a mental illness isn't always easy. There is no easy test that can let someone know if there is mental illness or if actions and thoughts might be typical behaviors of a person or the result of a physical illness. Each illness has its own symptoms, but common signs of mental illness in adults and adolescents can include the following: excessive worrying or fear, feeling excessively sad or low, confused thinking or problem concentrating and learning, extreme mood changes, including uncontrollable highs or feelings of euphoria, prolonged or strong feelings of irritability or anger, avoiding friends and social activities, difficulties understanding of or relating to other people, changes in sleeping habits, or feeling tired and low energy, changes in eating habits such as increased hunger or lack of appetite, changes in sex drive, difficulty perceiving reality, delusions, or hallucinations, in which a person experiences and senses things that don't exist in objective reality, inability to perceive changes in one's own feelings, behavior, or personality, lack of insight, overuse of substance like alcohol or drugs, multiple physical alignments without elements, without obvious causes, such as headaches, stomach aches, vague and ongoing aches and pains, thinking about suicide, inability to carry out daily activities or handle daily problems and stress, an intense fear of weight gain or concern with appearance. Mental health conditions can also begin to develop in young children because they are still learning how to identify and talk about thoughts, and emotions. Their most obvious symptoms are behavioral. Symptoms in children may include the following: changes in school performance, excessive worry or anxiety, for instance, fighting to avoid bed or school, hyperactive behavior, frequent nightmares, frequent disobedience or aggression, frequent, frequent temper tantrums. So, where to get help? Don't be afraid to reach out if you or someone you know needs help. Learning all you can about mental health is an important first step. Reach out to your health insurance primary care doctor or state county mental health authority for more resources. And receiving a diagnosis, knowing warning signs can help let you know if you need to speak to a professional. For many people, getting an accurate diagnosis is a first step in a treatment plan. Unlike diabetes or cancer, there is no medical test that can accurately diagnose mental illness. A mental health professional will use the diagnostic and statistical manual of mental disorders published by the American Psychiatric Association to assess symptoms and make a diagnosis. The natural the, the manual list criteria include feelings and behaviors and time limits in order to be officially classified as a mental health condition. After diagnosis, a healthcare provider can help develop a treatment plan that could include medication therapy or other lifestyle changes. Finding treatment. Getting a diagnosis is just the first step. Knowing your own preferences and goals is also important. Treatments for mental illness vary by diagnosis and by person. There's no one size fits all treatment. Treatment options can include medication, counseling therapy, social support, and education. So that's pretty much what mental health uh, includes. So I would strongly suggest that if you are having these symptoms, the ones I mentioned at the beginning of this video, the excessive worrying or fear, and the feeling excessively sad or low, and the rest, etc. Those ones I would start strongly suggest you look on NAMI and see what kind of help you may need. Like I said, go find a therapist and a psychiatrist. Get support. Talk with your parents. There's a stigma out there that that mental health is not something to talk about, but in my opinion, it should be talked about. If someone's not understanding what you are talking about, then that's probably not the person you should be talking to. But talk about it. Find that person who will understand, because there will be people that will. You'll find out that they actually understand. There's more people out there than you know that have a mental illness. Also, there are some who their son or their daughter or the person they live with. So they have a little bit of experience of what mental health is. So you can find out who that person is. And once you find out who that person is, talk with them as much as possible. Or get the support you need. Um, what really came to me was basically NAMI, and then after NAMI, my parents got into it, and so they understood, and so I could talk to them. I could talk to other people that were in the NAMI support groups, and then I got into went back to college, so I talked about with a few people at college, and I was able to I actually created a group in college. I had to actually do it with somebody else because I didn't have enough credits to actually form the group. So I did it. I did it. I formed a group about of mental health um, support group, kind of like, and it was affiliated with NAMI. So, and that's actually still there at Dixie State College 6 years later. So it's still actually there, going on and helping those who are going through a mental health crisis. Um, so mm, I did that, and I also later on met my wife, who has anxiety, and she has helped me to go through the go through my mental health. Uh, Basically, what I have schizophrenia, so I hear things and I see things that are negative. So I'll talk to you more about what my diagnosis is when I get to what schizophrenia is, and and that's all. That's really all I want to talk about today. I will Next time I will cover um, each. I think I'm gonna cover four, five. Let's do five. Yeah, I'm gonna cover five mental health um, conditions. So I'm gonna cover depression, anxiety, PTSD, schizophrenia, and bipolar. Those aren't the. Um, I might get into OCD too. Yeah, OCD. It's a six. So I'll get into OCD too. I'm going to talk about all six of them, and I'm going to cover each one in one video. So the first one, I think I'll go with schizophrenia just because I know it the best since I go through it. So I'll cover schizophrenia in my next video, and I'll tell you the definition, what it is. I'll go through um, the brain, uh, of how it works, and when you have schizophrenia, and what it does, what it looks, what it, I can't really tell you what it looks like, but I can explain it. So I will cover all six: schizophrenia, depression. So the next one I'll cover is anxiety, and then I'll cover um, PTSD, and then I'll cover bipolar, and then I'll cover OCD for last. So look forward to those videos. If you like this video, pretty much all I did was read what Nami explained. I wanted to get exactly right what mental health was, so I had to read it. If you want to read it, if you want to listen to it again, well, and not listen to me, and read it instead, it's right. It's on nami.org. So like nami.org/about mental um, illness/warning signs and symptoms. So you can basically just type in NAMI, and then type in what is mental health, and I'll get to that page um, where I where I read. So if you are better at reading things um, after you have listened to this video, then you can do that. Um, and that's all. Okay. Everybody stay safe, and look to get through your mental illness, and seek help and get support. Okay. See you later. Bye bye.